This is Average Joe PT, and today we're going to talk about shoulder impingement. All right, so go ahead, stay tuned, buckle up. Here we go. All right, folks, so I could make this an easy 45-minute discussion episode on shoulder problems. I'll probably do a bunch of little episodes about the shoulder, and today, like I said, I'm going to talk about shoulder impingement. Like I've said in the past, you have three joints that actually make up the shoulder. We call the shoulder girdle complex. You got the collarbone or clavicle, you got the shoulder blade, also known as the scapula, and then you got what we think the shoulder is, this ball called the humerus. Now today I'm going to talk a little bit about, as you see in the picture, the injection, what the doctor does and what they're trying to accomplish, and then also sending you to therapy for shoulder impingement. What is impingement? All right. Out on the World Wide Web, they're going to show you certain exercises to do. I'm going to give you the reasoning why and some exercises and treatments that you can do home, all right, instead of having to go to the gym. You got to do a million exercises. Maybe some manual treatment techniques, maybe some taping stuff that you can do, as well as the exercise and why you're actually doing it to reduce the impingement. All right, so go ahead, stay tuned. We're going to talk a little bit more about, first of all, some treatment techniques that you can do. All right, I'm going to bring you up close here. So when they go and do this actual injection, so this pen I have here is representing the main muscle. There's four muscles that make up the rotator cuff. But this top one, if we kind of flip it so that you're seeing the back side of your body. And so that pen comes all the way through, traverses underneath your collarbone, all right? And it also goes underneath what we call this acromion. So if we come up close, you can see how that pen, and then it actually comes all the way around and then attaches to kind of the front side of this. All right, so you can come around, that tendon comes all the way around, stretches to the front side of this. And so what they do is they go underneath what's called this is called the acromion. They go underneath in what's called the subacromial space, and they put a steroid injection in there. And so essentially what that does is it bathes this tendon and also the bursa that's in there and kind of shrinks that. And so what that does is it allows more space between, take this out here, the space between basically the roof and the floor of that tendon that comes through it. And as you can see, if we kind of give you a bird's eye view, you can see how that, representing that pen, the tendon has come all the way through underneath all that structure. And any of that and all of that can cause that tendon, that main rotator cuff called the supraspinatus tendon, to get irritated. So that's what they do. They just go in and shoot that thing underneath called the subacromial injection, and they shoot that with steroid, and then hopefully, wait a couple days and then send you to physical therapy. So that's the idea behind the injection. So let's go ahead. I'll tell you some exercises and the reason why you're doing the exercises. All right, so go ahead, stay tuned. All right, so all the exercises essentially are designed to open up the space there. If we're doing any exercises that closes down the space or throws your shoulder forwards at all, you don't want to do any of those. They're going to reinforce that impingement or pinching of this main tendon that comes across in between, all right, your supraspinatus tendon. That's the major one of the four rotator cuff muscles. We could say the fifth is the long head of the bicep. Kevin Wilkes and the rest of them, you could fight over about that. He's one of the big gurus in shoulders, at least through physical therapy realm. All right, but the four major ones, this being the main one, that seems to get torn and pinched a lot, the supraspinatus, as you can see how well it can get compromised in there. So anyways, that being said, we're going to give you some stretching techniques to stretch out that pec muscle coming through the front, whether it's attached at this bone, the pec minor, all right, or the major that comes across, always coming across. We want to make sure that we open up the shoulder as much as possible and drop it down. So all our exercises are going to be opening up the space and pulling the shoulder back. The taping techniques that I show you today are going to be the same thing. The cross-friction massage and massage that we're going to do today, it's all about opening up the space and giving that tendon time to breathe, all right? So I'm going to go ahead and show you the taping technique next. Stay tuned. Here we go. Like I always say, tape, 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 tape. Everything's about tape. In this case, you're going to wear this tape for 2 days. Now, it's the same tape that I've used for the foot, for the knee. I'm going to keep showing you taping techniques that you can do through your whole body. Essentially, what we're going to do with this tape is we're going to put your shoulder blade in a specific position so that it actually opens and drops it down. You're going to wear it for 2 days. All right, this shouldn't hurt. You might feel just a pull in the front. This should not give you any pain down your arm. And you're going to use both in this case. This is the coverall that goes on your skin first. All right, and then you can put the brown tape over the top of the white tape. So start with the white tape. Now, obviously, you're going to need 2 people for this. Pretty simple to do. All right, we're going to take the shoulder here, and all we're going to do is take the white tape, bring it to the front of the shoulder, and come across the back. That's essentially it. All right, now you can do it in that angle, and then you can come across, all right, and pull across this angle. Essentially, what you're doing is if there's a tilt to the shoulder at all, you're pulling the shoulder back and down. All right, if we're kind of like this, we want to pull your shoulders back and down. And so the taping technique, start with the white tape, is literally going to come to the front of the head. All right, right here at the front. You're going to put that tape across the back and go all the way back to the shoulder blade. So it's going to be a fairly long piece. Now that white piece is just to protect the skin. Now the brown, it's going to be a little bit shorter. You don't need as long as the white because you want to give a nice little pull so that the shoulder goes from this position, like most people. All right, it's going to go back and down. All right, and what you can do is tell that person to get in this position and then tape them in this position. So, wear it for 2 days. If you get any pain, take it off immediately. That means you've probably pulled down too hard. You should just feel a nice stretch in this area in the front. And what it should do is also this muscle in the back, which is attaches to your shoulder blade. We've talked about that in our neck episode. If you want to go back to that, it's in my actual, if you subscribe down below and push the button, you can go ahead and see the neck one. That's all about reducing your neck pain. But in this case, that same muscle, that levator scapula muscle that attaches to the top here, runs all the way to your neck. That's your main pivot muscle. So that muscle allows your shoulder blade to drop down and up as your hand goes over your head. All right. And so what happens is if you're tilted forwards and like this, it puts that muscle group on stretch. All right. And so when we put it back and down in the correct position, that puts that muscle group in a nice shortened position so it's not over elongated and getting irritated. So as well as impingement, all right, this will also help neck issues with that taping technique. So you can apply that for both. But essentially, all right, you get rid of that levator scapular irritation at the back in the shoulder blade. People rubbing that a lot. That's really just that muscle group. It could also be a rhomboid too, but it's mainly that one. And then obviously we're opening up the space, and that's what we're talking about this episode, opening up the space between the acromion and the humeral head. All right, so that's the taping technique that you can do in your own home. The physical therapist is going to do the exact same thing. They're going to charge you. You're welcome. I'm giving you serious education, all right? Hopefully a little bit of humor. And that's what it's all about. This is what this channel is about. So please subscribe down below, all right? Now, the second technique in treatment is Mr. Magic Towel. Mr. Magic Towel, always there for you. Always to bring you back home. What you're going to do with Mr. Magic Towel is like what we did to improve your posture and bring your neck in position and reducing that levator scapula pain is you're going to take that towel. All right, now this one you might have to make a little bit thicker, but I'm going to cheat. I'm going to just kind of fold it in half. You're going to put it right back at that mid back here. Let's see if I can get it up high enough so you can see it on camera. All right, let's see if I can get it in the right spot. Here we go. Let's see if I can get it right. Here we go. Hold on, folks. So as you can see, let me pop it up a little bit. That's going to naturally bring that shoulder blade back and down, all right, when I push against that towel. And that'll kind of keep you in this nice position instead of a forward position when you're kind of typing or you're looking down at your phone, all right? So you always want to have your shoulder back and down, all right? That's going to open up the space. So you might need a little bit thicker, all right? Easy to do. Just take it, Take this wherever you go. If you're in the car and you're having that shoulder pain, put this in your car because you're going to be up like that, and it's a classic case of irritating that shoulder. Another good thing you can do with towel, now that I'm thinking about it, is at nighttime, put it underneath that armpit. All right, if you put that towel underneath that armpit, it's going to put all those muscles in a nice shortened position. And at least maybe if you're having some pain at nighttime, you can fall asleep on your left side, and it will take a lot of the stress off all that rotator cuff, including that supraspinatus that I'm talking about here. You can't see it, but I got the model over here. So it'll help reduce that pain, having that silly towel or a pillow. You want to take a pillow and put it underneath there instead, but I always use magic towel wherever you go. This is the key, folks. Something cheap, something you can do at home to help reduce your pain. You see the doctor, he does the injection. These are a couple things you can do at home before you see the physical therapist. That's going to show you some other stuff. You might also do some ultrasound, some E-stim, so that muscle group in the back there to get that to relax a little bit. Manually stretch you and put you in some other positions that obviously you can't do by yourself at home. So let's go ahead. I'm going to show you a few exercises that you can do once you got yourself in the proper position. All right, stay tuned. All right, folks, we're back. And so I'm going to show you a couple exercises I want you to do. Now, when you're doing any exercises, whether you're at the gym, all right, or whether you're at the physical therapy clinic or chiropractic clinic, who knows, but you always want to put yourself, in this case, the shoulder and the shoulder girdle, in the correct position before you start strengthening. Because if it's not in the correct position when you start strengthening, you're going to strengthen the muscles to reinforce the problem. So I see this a lot with a lot of newbie kind of therapists. You got to put the patient in the correct position before you start strengthening. Otherwise, you're just reinforcing the problem. All right, so here we go. We're going to take Mr. Towel, Mr. Magic Towel, and we're going to put him right at my mid-back. All right, so this is a nice firm chair, and you can see Mr. Towel there. And I'm going to extend my back a little bit, because as I extend my back, you see how forward my shoulder is? As I extend my back, my shoulder naturally falls back. This is also just going to naturally stretch out your chest a little bit. You're going to hold this position for probably 5-6 seconds, and then come back and relax into your normal slump position, and then you're going to rinse and repeat. All right, so you're going to do this for about 10-15 times, holding for about 5 or 6 seconds, and then come back and relax, and then you're going to come back. All right, the second one you're going to do, now, I have a rubber band. You don't need a rubber band. The rubber band is for resistance. Now, when this thing is hurting, the last thing you want to do is start strengthening it. So the taping techniques, all right, the positioning for the towel when you're doing any type of sitting, and this first exercise, extending your chest back. Those are good exercises to try and reduce that pain. All right, so the next one is essentially just with your hands, making a fist. All I want you to do is kind of open up. So your elbows stay right by your side, and your hands kind of open up. You're not holding on to anything, just kind of opening up, keeping that shoulder back. This should not hurt, only come to the point where you don't feel a pinch. If you go too far with your hand, you might start to get that tendon irritated again. All right, so that's your second one. All right, and the third one is just pinching your shoulder blades together. Hold for about 5 or 10 seconds, and then relax. Pinch those shoulder blades together, hold for 5 or 6 seconds, and then relax. Those are 3 easy exercises you can do at home after you've had this injection. All right, do the taping, do the towel, all right, magic towel with positioning, all right, and then do those 3 exercises. That's going to get you on your way before you see the therapist and reducing your pain, because you're stretching out the chest muscles, you're putting your shoulder in the correct alignment, and you're starting to do the exercises in the correct alignment. So that's perfect for impingement, all right? You're going to get yourself way far ahead if you start doing this stuff early enough, all right? So that's some exercises, some taping techniques, the magic towel, and obviously ice it. You know, if the thing's inflamed, you want to ice it, like I always say, 10-15 minutes. Just don't burn yourself, and try and do that several times a day. Now, that supraspinatus, if it's irritated enough, it'll give you a referral pain down the side of your arm like a deep ache or a toothache. Sometimes it can even travel under the elbow. All right, so expect that. If this is getting irritated more, you want to back off. It should not have any symptoms down your arm. Now, that's a classic case of rotator cuff irritation if it's giving you symptoms down laterally down the side of your arm. So those are the 3 treatment techniques. Now I'm going to show you one more. I'm going to show you a little bit of the massage technique that obviously you're going to have a family member do. You know what? I'm going to give you a little bonus. I'm going to show you something, all right, that you can easily purchase or you can accommodate with something else. So stay tuned. I'll be right back. I'm going to show you what I'm talking about. All right, boys and girls, here we are. I'll show you little tricks of the trade. This you can get off the internet for probably $10, $15 at the most, depending on which website you go off of. But this thing is called the TheraCane. It came out a long time ago. They make them in multiple colors now with multiple knobs. All right, but they came out, it was a green one a long time ago. It's pretty durable. You get one of these, it's gonna last a lifetime. Essentially, it's very small. What you do is you're gonna take it and you put it right back on that levator scapula spot. And you kind of just apply a little bit of pressure, kind of hold it there. Don't go to a point where you're killing yourself. All right, but as you can see, you get that sweet spot right where that levator scapula is. And you're gonna hold that. You might hold it for 30 seconds to a minute. And then relax and rinse and repeat. Now, if you ain't got one of these, you could easily just use a regular cane. Now, I don't have a cane here, but you know the walking stick cane literally has the same hook. Anything with a neck over like that that has a little bit of a shaft, you can easily simulate this exact same position, and you can get those little knots. Now, if you ain't got one of those two gizmos, you can always use a tennis ball. And a tennis ball, you would just take it back there and then roll it against, now, in this case would be the floor or the wall. You need to have another surface against that actual ball. But those are some different treatment techniques that you can do for massage, all right, that you can do by yourself. Now, you can always have someone apply that same pressure like you would do with this knob. All right, they're doing it with their fingers, working that nice and easy, but you could do the same thing. All right, if you don't have someone, you could use this or a cane. Now, when you do this, you probably want Mr. Magic Towel behind here, so you got a nice, good position as you're actually doing this, or you're having someone do this. All right, don't be slumped down like that. That tissue is very elongated. You want to put that tissue in a nice shortened position and then actually do the release, all right, and do the deep tissue massage. Don't try and do it where you're all stretched out. All you're going to do is irritate it more, all right, because it's already over elongated to begin with. So that's all the treatment techniques, some basic exercises, all right, for this impingement problem. So like I always say, subscribe down below. Pick one of my other topics that I'm coming out with. I'm always bringing you more content. Ring the bell. All my subscribers, I love you. Thank you. Bring some more. I'm going to bring some more content. I'm not sure next time if I'm going to talk a little bit more about the shoulder. I might do another episode of that. Some other types of problems with the shoulder. Maybe post-surgical again. And then we'll get into the hip. But leave some comments down below. Give me, what do you want me to talk about? But I'm going to at least dive into those. If I don't get any comments, I'm just going to keep rolling with it. All right? So stay tuned. And like I always say, look up and keep smiling.